This map tracks the spread of a virus we thought we had beaten. In the early months of 2026, the United States recorded over 3,500 confirmed measles cases across 46 states. The highest concentrations of these infections sit right here in Texas and South Carolina. And for the first time since 2015, the U.S. has recorded measles-related deaths, including 2 unvaccinated children in Texas. In the year 2000, public health officials declared measles entirely eliminated from the country. Now, the sustained scale of this current wave threatens to strip America of that hard-won official status. Behind the national statistics are local communities operating on high alert. Neighborhood buildings and clinics are posting stark warnings on their doors, instructing anyone with a fever and rash to stay outside. America is sliding backward, losing ground to a lethal disease it had decisively conquered a quarter of a century ago. Before the introduction of the measles vaccine in the 1960s, nearly every child in the United States caught the virus. Families sat anxiously by bedsides, hoping to avoid complications like pneumonia or hearing loss, which killed 400 to 500 Americans every year. That reality ended because of massive, coordinated vaccination drives. Public health workers went directly into schools, systematically immunizing entire generations of children. Health departments and schools meticulously tracked those shots on paper records, maintaining an administrative wall that kept the disease at bay so effectively, society eventually forgot how dangerous it was. The measles virus causing today's outbreaks is the exact same pathogen from the 1950s. It has not mutated to bypass our immune systems, and it has not become biologically stronger. Because the pathogen remains unchanged, its sudden return tells us that our societal shield is breaking down. To fix it, we have to look at how that protective barrier actually works. Measles is one of the most highly contagious human viruses ever identified. It spreads through respiration and hangs in the air of a room, remaining infectious for several hours even after the sick person has walked out the door. If 10 non-immune people share that airspace, 9 of them will contract the illness. This population grid illustrates how a community stops an efficient pathogen. Epidemiologists calculate that 95% of a population must be vaccinated to achieve herd immunity, creating a solid wall that prevents the virus from finding vulnerable hosts. In 2019, the national kindergarten vaccination rate sat right at that 95% threshold. By 2023, it had dropped to 92.7%. A national average often masks severe local vulnerabilities. In the specific Texas communities driving the current outbreak, the vaccination rate fell to 82%. This decline traces back to a combination of rising vaccine hesitancy, active misinformation campaigns, and a high volume of missed routine pediatric appointments during the COVID-19 pandemic. A drop of 2 or 3 percentage points sounds small, but across a nation of hundreds of millions, it creates a massive pool of susceptible targets for an airborne pathogen. This domestic drop in coverage collided with a global surge. Recent data shows an estimated 10.3 million measles cases occurring worldwide, driven by massive outbreaks in countries like India and Yemen. The virus crosses borders quietly. Unvaccinated travelers contract the disease abroad, fly home without showing symptoms, and inadvertently spark outbreaks the moment they return to under-vaccinated U.S. communities. Once it takes hold in a neighborhood, the physical toll is rapid. Infants and young children develop high fevers, respiratory symptoms, and a painful full-body skin rash. The rash is only the visible symptom. Inside the body, the infection frequently leads to severe pneumonia, dangerous inflammation of the brain known as encephalitis, and a high risk of long-term hospitalization or death. Even after a patient survives the initial illness, they face a secondary threat, a phenomenon doctors call immune amnesia. The measles virus infects and destroys up to 75% of the body's memory T and B cells. It literally deletes the immune system's record of past illnesses, leaving the child completely vulnerable to everyday bacteria and viruses they had already fought off. Surviving a measles infection forces a catastrophic reset of a child's internal biological defenses. The damage to their immune system lasts for years after the rash fades. Once a person contracts measles, modern medicine has very little to offer. There are no effective antiviral drugs available to cure the active infection. Physicians can only provide supportive care and wait. The only reliable defense we have is prevention. 2 doses of the standard MMR vaccine provide 97% protection against the virus, stopping the illness before it can take root. For infants under 12 months, pregnant women, and patients with compromised immune systems who cannot safely receive the vaccine, doctors rely on a strategy called cocooning. Cocooning requires every parent, caregiver, and household member to be fully immunized. They form a physical barrier of immunity that the virus cannot cross to reach the vulnerable person in the center. The medical tools needed to stop these outbreaks are exactly the same ones that eliminated the virus in the year 2000. The only variable that has shifted is the public's willingness to use them. Containing this airborne threat is entirely within our control. It requires restoring trust in public health data and rebuilding that web of community responsibility. Measles did not return because the vaccine failed. It returned because protection weakened. Measles is preventable. Vaccination saves lives.